So my name is Mary South. Some of you already know me. Um, I am a urogynecologist. I grew up in Ohio. I went to medical school at Case Western Reserve, and I did my training at UNC in Chapel Hill in OBGYN, and then I did my fellowship in urogynecology at Duke University Medical Center. So tonight, I want to talk to you about some different ways that we can treat bladder control problems. It's something that people don't always like to talk about. So this is just one way of getting the word out to people. As you can see from this quote from this patient here, she reports feeling tired of rearranging her schedule around the bathroom. She says the bathroom, it's always on her mind where the nearest bathroom is. And I hear a lot of patients say that to me, that no matter where they go, they know where there's a bathroom. However, a lot of people don't want to talk about this with their physician. 44% of people say they're embarrassed to talk about bladder control problems. So again, getting the word out and doing webinars like this is a good step in the right direction, so that people know what's out there and to know that they're not alone. So we're going to work through this topic today, tonight, and the main focus towards the end of the presentation is really on Medtronic Interstim therapy for bladder control. But basically, we're going to first start with understanding bladder control. You know, what does control our bladders? Why is this happening? We're going to go through the care pathway, which is if you came to see me from basically the beginning of the treatment and the diagnosis all the ways through the advanced therapies. And then we're going to specifically talk about Medtronic bladder control therapies. And then at the end, we will have some time for question and answers. Okay, so again, I just wanted to reiterate that you're not alone. I think one of the things that I always want to impress upon my patients is that I hear about these symptoms day in and day out. 30, 40 patients a day come in and talk to me about these symptoms. So it's not just you. 1 in 6 adults have overactive bladder. It is more common than vision problems. It's more common than diabetes. As you can see, 37 million adults in the United States have overactive bladder versus 12 million with vision problems and 30 million with diabetes. And we normally consider diabetes and vision problems a very common problem. So 1 out of 6 adults have overactive bladder, and it can affect men and women of all ages. I see patients from their teens all the way through their 90s. Overactive bladder can disrupt people's sleep. People get up at night to go to the bathroom a lot. That can make for hard days if they're tired. It can affect your body image, your self-esteem, and overall poor feelings about your health and well-being. So a lot of patients will say to me, well, it's normal as you get older to have bladder problems. My mother or my grandmother had problems controlling their bladder. Well, I would argue that it's not unusual, but it's also not normal. In other words, it is a health condition. If you're going more than 8 times a day, or if you get that urgent sensation to go to the bathroom, or if you're planning activities around going to the bathroom, you probably have overactive bladder. Sometimes people will even fluids restrict, which is not good on many different levels, and spend a lot of money on pads to control leakage episodes. So basically, if you're experiencing these things, yes, it's common, but it's not necessarily normal, and it is a condition that can be treated. So how is the bladder controlled? The bladder is very much tied into the central nervous system. So the brain and the bladder communicate with each other. As you can see here, the kidneys produce urine. Then the urine is passed down through the ureters to the bladder. When the bladder is about half full, it starts to stimulate nerves that then send a signal to the spinal cord, then to the brain. And this signals your brain that it's time for you to go to the bathroom. So bladder-brain communication is essential for bladder control. And when there's a problem with that communication, when that communication breaks down, that is when you can have bladder control problems. This information is important for a couple of reasons that I'll mention later. First of all, in helping you to control your own bladder spasms with Kegel exercises. And also this helps illustrate why the Medtronic bladder pacemaker can help with controlling bladder symptoms. So just keep this slide in mind as we move along. So what causes bladder control problems? So why does it happen, I guess, is the real question. What this slide doesn't say, but what I think is really important is that as we do age as women, overactive bladder and men, overactive bladder becomes more common. So there is a correlation between aging and overactive bladder. And I also believe that what happens is that as estrogen levels decrease, then we develop what we call the genitourinary syndrome of menopause, which is um, irritative voiding symptoms like overactive bladder, discomfort, vaginal dryness, recurrent bladder infections. All these things kind of go hand in hand, and it's likely related to decreasing estrogen levels. But also, as we get older, a lot of people will say to me, well, I didn't have this problem when I was younger. Well, you probably didn't have hypertension when you were younger, and you didn't have diabetes when you were younger. So as we get older, well, somebody said to me the other day, your warranty begins to expire. Mine definitely is starting to get that way. My warranty is almost up. But at any rate, other things can contribute to overactive bladder, like daily habits, including what you eat and drink. So, I have some patients who drink a lot of coffee, caffeinated coffee, or black tea, which is caffeinated. I have patients who drink a lot of Diet Coke. Caffeine and certain foods can be irritating to your bladder. And so really, water and herbal teas, herbal naturally decaffeinated teas are sort of more kind to your bladder than some of these other items, including, besides just drinks, food items such as spicy foods, highly acidic foods. Those can also be irritating to the bladder. Medications can also lead to overactive bladder symptoms. For example, if you're taking Lasix or any kind of diuretic because of hypertension or fluid retention, that after you take that medication, you're going to be peeing a lot after that. And then pregnancy, childbirth, and basically pelvic floor injury related to that can cause bladder control problems. So there are three main types of bladder control problems. We have stress incontinence, urinary retention, which is where you don't empty your bladder well, and overactive bladder. And we're going to talk about all three of those. So stress incontinence is a leakage with cough, laugh, sneeze. A lot of patients will say they can't jump on a trampoline with stress incontinence. And this tends to be more related to a pelvic floor injury like childbirth, but it can also be related to weight gain, chronic cough. So basically, some of these patients develop overactive bladder because either consciously or subconsciously, they know that if they empty their bladder, that more often that they won't leak as much. So sometimes when we fix stress incontinence, which is usually a minor outpatient surgical treatment, although there are other non-surgical options as well, when we fix the stress incontinence, sometimes people's overactive bladder improves as well because they have more control. Now, urinary retention can occur. That's when you can't really tell your bladder is full or you're unable to fully empty your bladder. Some people notice a weak or dribbling stream. Sometimes we have to teach people how to catheterize themselves. That can also lead to some bladder control problems. You can have overflow incontinence. And basically you just don't have good control over your bladder. That can be related to MS, neurologic diseases. It can be an obstruction from a previous urethral surgery. So that's something that we explore as well. And anybody who comes in to see me, we do check for voiding dysfunction as a potential cause for their bladder symptoms. Interestingly, Interstim therapy that we're going to be talking about tonight, the bladder pacemaker, also treats urinary retention. So overactive bladder, which is the main focus for tonight, is a triad of symptoms. It's urge incontinence, urgency, and frequency. Now, you don't have to have all three of those. You can have urgency an urge incontinence without having frequency. You can have frequency and still have overactive bladder, but never have urge incontinence. So urge incontinence is going before you reach the bathroom with frequent leaks. A lot of women will tell me when they're doing the dishes, they all of a sudden they'll get a sudden urge and they won't be able to make it to the bathroom in time. And then other people simply have overactive bladder where they just frequently have to go. They're going more than 8 times a day and they never really feel like their bladder is empty. So the good news is we have treatment options for this. We definitely do. I usually tell my patients to be patient with me because sometimes it takes a little bit to work through what is going to work for you as a patient. There's no one size fits all and there's no magic bullet. So basically I have to kind of work with each patient to figure out what is going to be the best treatment option for them. So we basically start with the diagnosis and then we work through different options, starting with conservative treatments like lifestyle changes, combine that sometimes with oral medications, and then we can move on eventually to advanced therapies. So what kind of lifestyle changes? I think I alluded to this before with avoiding caffeinated beverages and certain foods that may be irritating to the bladder. So really, your diet can impact your bladders significantly. Exercise, actually there have been multiple studies that have shown that Pilates can help with bladder control. But also pelvic floor strengthening like Kegel exercises. So as the bladder is very much controlled by the nervous system, when you squeeze your Kegel muscles, if you squeeze for a good 10 seconds, you can generate a signal that goes to your spinal cord, which then goes to your bladder and helps your bladder relax. So if you're having an urge, squeezing your Kegel muscles can help that urge pass. As a matter of fact, I often tell people, don't try and beat your bladder to the bathroom. First, stop in your tracks, squeeze, get the urge to pass. Once the urge passes, you have a good 10 minutes, hopefully, before the next urge hits. And then there's other things, formal pelvic floor physical therapy, which we offer in our office and also around the area. There are other physical therapists that we refer to help with bladder retraining and biofeedback. Now, conservative measures can be done alone or in combination with oral medications. Oral medications are kind of like our first step down the pathway after conservative measures, and they have they are effective for some people. Unfortunately, the vast majority of patients end up off of medication for various reasons by the end of 1 year. Mainly the fact that the medications have unpleasant side effects. So dry mouth, blurry vision, constipation, and the medicines have to be taken every day. Some people are already on a lot of medications. They don't want to add one more medication to their list of medications. And sometimes the medications just simply don't control the symptoms. So given that information, it is questionable why we would even try them in the first place, but quite frankly, they do work for some people, and insurance companies usually will not allow us to move forward with advanced therapies unless a patient has tried 1 or even up to 3 oral medications. So once we've sort of exhausted the oral medication route, we can move on to advanced therapies. And there are 3 main therapies that we offer in our office. The first one is called the neuro system, which is basically it's an ankle stimulator, and I'll explain it just a little bit more in a minute, but this is a system that can be done in the office that can help with bladder control. There's the Medtronic Interstim therapy, which is the bladder pacemaker, and then there are injectable medications, namely Botox. And they each come with pluses and minuses, honestly. So for Botox, this is a very nice treatment option for patients. Basically, we offer this in the office. It takes about 3 minutes. You come into the office. I put a tiny camera inside your bladder and I inject Botox along the bladder wall. And that usually takes about 3 or 4 weeks to kick in, and it lasts about 6 to 9 months. So you're usually looking at 1 to 2 injections per year. So the downside of Botox is that you need repeated injections. It's not a cure. The other potential downside of Botox is that sometimes it works a little too well, and some patients have trouble avoiding on their own for a few weeks after the Botox. This is pretty uncommon, but and we work through that, but that is a potential side effect of Botox. So then moving on to the neuro system, this is been proven to restore bladder function and improve quality of life. It does reduce urgency, frequency, and incontinence. And it does have some lasting relief without side effects, without the side effects of medication or the need for catheterization, obviously. Um, basically, this is a treatment though that requires you to come into the office once a week for 12 weeks. It's a 30-minute treatment. And then once you have your 12 treatments under your belt, then then you have to do monthly maintenance sessions. So this is a very time intensive treatment option, but you can see we put a small acupuncture needle right along the ankle here, which goes into the near the tibial nerve, and then we attach it to an electrical stimulus that sends a current up to the spinal cord, which works in a way to help normalize the control of the bladder's natural reflexes. So again, this is a reasonable option. We do offer it. It tends to be my third option after Botox and Interstim, only because it is so time intensive. So, so that brings us finally to the Interstim system. So basically, Interstim restores bladder function by gently stimulating the sacral nerves. It's clinically proven to stop or reduce accidents. It significantly improves quality of life, and it's been in use since 1997. I've personally been using it since 2005, so about 15 years. And the nice thing is that the technology has changed significantly in that time. The batteries, the little pacemaker goes in your butt cheek, basically, in a little fatty pad in your butt cheek, and it's and most of us have a little bit of fat, so it's easy to find a good place to nestle it in. But basically, it's connected to a tiny wire that stimulates the sacral nerves, and this can be placed in the operating room under twilight sedation, just like a colonoscopy. And it's nice because the battery itself, or the pacemaker, can last anywhere from 5 to 15 years, depending on which type that you choose. There's a recharge-free version that is a little bit bigger battery, but the battery lasts 5 to 7 years. And there's a rechargeable device that you can recharge once per week. It's very, very tiny. The battery is very, very tiny, but it lasts about 15 years. So that's something that we always talk about. The nice thing is that we have to test this procedure first to see if it works. And if it works, that's when we go forward and we put the battery in. But this can be done in a procedure in our office. It usually takes about 15 to 20 minutes. We place 2 fine hair-like wires just under the skin next to the tailbone, and we attach it to a little battery that you wear around your waist for about a week. And you keep track of your daily symptoms. And then when you follow up with us, we determine if it improved your symptoms by at least 50%. And if it did, then we can move forward with putting in the pacemaker. But we always want to make sure that the pacemaker works for you before we actually put the real thing in there. So does it work? Definitely it does work. I have a lot of satisfied patients. There's an 84% satisfaction rate among those patients who do have the pacemaker. And 76% of people achieved success with Interstim compared to 49% with medications. It basically offers 3 times greater improvement in quality of life compared to medications. And that is what I do see in my clinical practice. I'm a huge proponent of Interstim therapy. Like I said, I've been doing it for 15 years, and the device seems to be getting better and better with time as well. So we're seeing really excellent results with it. So, who is a candidate for Interstim? If you have significant overactive bladder or urinary retention, so patients who are unable to pee on their own, as long as it's not due to some obstruction from a surgical procedure or something else, um, um, those patients would benefit from it. And you have to first demonstrate that you've tried some lifestyle changes and oral medications, and that these treatments haven't given you the relief that you want. And as I kind of described earlier, that's pretty common. So most people end up being a candidate for Interstim. It is covered by most major commercial insurances, as well as Medicare and some Medicaid programs. So that is something that we prior authorize for in the office prior to the procedure, but it is usually or generally covered by insurance. I'm not going to click on the video here, but I am going to post it on my website. But this talks about a patient who's had success with Interstim system. So that is all I have for you at this time. Here is our information if you want to give our office a call. I know some of you are current patients. There's also our email address listed at the bottom. So I think at this point, I want to open it up to questions. So let me stop sharing this for a minute here. And all right, so does anybody, Mike, are you there?
Yeah, I'm here, Dr. South. Thanks, and that was a great presentation. If anyone wants to add a question or have a question come into Dr. South, if you could please do so via the chat function at the bottom of your screen. And it looks like our first one that's coming in, Dr. South, I'll just read them off to you because I don't know if you'll be able to see it.
I can see him, Mike. So this person said, I sometimes also have bowel leakage. Does the Interstim device also help that? As a matter of fact, it does. I failed to mention that in this presentation only because I was kind of focused on overactive bladder, but I have tremendous results with it for fecal incontinence or bowel leakage. As a matter of fact, I think my success rate with that is probably higher, maybe in the 90s, 90 percentile, 95 even. Most of my patients who we take to the OR for bowel leakage have an improvement. Hope that helps. Anybody else have any questions? So the next question is, what is the best next step if I want to talk about getting a test? Well, basically, you would just call our office, or if you're not local, obviously you would want to call your local urogynecologist, but you would call our office and we would set you up for an appointment to talk about what you've done. We basically need to document what you've been treated with in the past and what has helped you, and then we go from there. And the test is done in the office, but we don't do that. We wouldn't do that at the initial visit. We would schedule that and get it prior authorized. Any other questions? These are anonymous, so if you are wanting to type in a question, I can't see your name and nobody else can either, so if that helps. Speaking of people feeling embarrassed by this topic. I also want to mention that I do have a podcast now called Girl Problems. It's available on Spotify and some other platforms. And our first two topics so far have been pelvic organ prolapse and overactive bladder. Okay, I've got another one. It said, I've already tried Botox and it helped some, but wish it helped more. Is it possible I would need a device in addition to having tried Botox? Yes. So the nice thing is that with Botox and Interstim, you can go back and forth. So if you try Interstim and it helps you, but it's not, exactly what you want, or it doesn't get you exactly where you need to be, then we can always add in Botox. If you do Botox and it helps you, but isn't quite all the ways there, then we could do Interstim. One does not preclude you from using the other. I have another thing here. Oh, this question was, can you please explain how estrogen could help with reducing the number of times having to pee every day? Well, estrogen is very important for a couple reasons. Number one, um, if you sometimes just the having dry, thin skin around the urethra and the vagina can lead to just irritative symptoms, so that overactive bladder symptom. There are really actually estrogen receptors that march up the urethra and into the bladder, and even using just a little bit of cream at the urethra can help soothe that irritation basically and help with overactive bladder. The other thing that using estrogen cream does as well is that it plumps up the skin and creates a moisture barrier so that bacteria can't get up in there. So if some of your overactive bladder is accentuated by um, uh, the maybe recurrent bladder infections, that can help as well. I've got another one here. It said, if I get an Interstim device, can I still get an MRI? So that's the nice thing about the new technology that has just come out this past year, FDA approved. The lead and the generator, both the small micro battery and the bigger battery, are all MRI compatible. We used to only be able to have you have an MRI of your head, but now you can get a full body MRI even with the device in place. And the next question is, will I feel the implant under my skin or can it be seen? So I'm going to start with it. Generally can't be seen. Nobody can see like a lump under your skin or anything like that. But with the recharge-free battery, if you press on your skin, you can kind of feel the smooth battery underneath your skin, and it's not it's very discreet. With the micro battery, the 15-year battery that's rechargeable, it is very, very difficult to feel it under the skin. All right. Any other questions? Hold on one second. All right, there's you can send in questions via chat or the question and answer button. But I think that's it. So, all right. Thank you very much. Have a wonderful evening.